Welcome back. Let's get you more updates now. This coming in from the national capital at a time when the dedicated hospitals in Delhi and Mumbai are running fast out of beds. Now, there are several hospitals which are providing facilities of 24-hour oxygen facility and ventilators, with also a healthcare worker monitoring the status of the patients at all times. My colleague Ayushman brings us this report.
We are offering a trained nurse who will be placed in that person's home, and she will be monitoring the person 24/7. Along with that, we are providing all the equipments. Now you will ask what all? Oxygen concentrator. That is a device which will give you continuous oxygen. There is a backup oxygen machine, backup oxygen cylinder I mean to say. Along with that, a monitor which will monitor all the pulse rate, blood pressure, oxygen saturation. An infrared thermometer is also there, which will regularly monitor the temperature. Along with that, we are giving various oxygen delivery devices like nasal prong face mask, and there is a backup BiPAP machine which we will use in case of severe breathing discomfort if patient is not being controlled with the oxygen alone. So that will buy us time so that we can take the patient to the hospital safely and he can be managed further.
How do you monitor the entire, because critical care is very important in this, because even in the health ministry guideline it has been mentioned that if the oxygen level drops, a doctor's intervention is required. How do you monitor that? How you keep a pace with the required amount of time that a patient needs?
Patient or the family and the staff can contact me in three ways. One is directly they can call me. Second one is we have made a social media group. In that, whole the family members, my technical team and me and other medical staffs are over there. So my staff is regularly updating all the parameters. If there is any issue, I can see that, or I can call up, or from my staff she will call me up that this patient is having this issue. Now what to do with the oxygen, which face mask to use, all those calls will be taken by me.
In case of a medical emergency, what is the backup plan if a family takes this setup, and if the oxygen level drops, or if there is an urgent need, what is the backup plan?
My best backup when anything is not working, this BiPAP machine. This will save the patient's life. It's just a mini ventilator. So this will save the patient's life, and we will deliver that patient to the nearest hospital, and we will help the family to look for which beds are available in the hospital.
My patient is diabetic and was suffering from very high fever. I called them, and the very next day they came to my house with all the ICU setup and a well-trained nurse. They created a WhatsApp group, including all my family members, a doctor, Mr. Dixit, to consult with, a logistics person who is taking care of all the equipment, and a well-trained nurse, Mr. Life. The nurse updated the fever, the BP, the oxygen level, the pulse after every 2 hours in a group. A complete hour-wise chart of medicines and readings. What he was updated on the WhatsApp group was recorded on a sheet so that a doctor can consult it and advise accordingly.